But if you put your money into primary care and have a doctor that you know, trust, have a good relationship with, number of hospital admissions plummet. What a daft place to put the funding. If you really want to sort of address the issues, put the money where the results are.
I went to the GP in May of last year, in May of this year, and it was for a standard, a minor thing, I thought. But on a standard CT scan, they picked up an astute radiologist had picked up the fact that I had a malignant, a highly 80 to 90% probability malignant tumour. It was 2.1 centimeters in size. So I was put on what was the fast track pathway, 2-week pathway for cancer, and that was very good. I saw a surgeon over here on the Wirral, and he was very good, and he said that highly probable that it's malignant. And he gave me a number of options for treatment. One of them, which is the gold standard, is removal of the kidney cancer, surgical removal. I asked how long that would take, and he said there's a waiting list, but it would be 8 to 12 weeks as an indicative. I've now been waiting almost 6 months. I've raised a letter to the CEO of the hospital, and I'm waiting a reply. I did call the hospital, and after having been sent being asked to go for a pre-op, which was cancelled the day before. So when I rang up after that to find out when the operation would be, and they said it's probable now, it would be the new year. And that's where I am at the moment.
Well, I mean, in a sense, your story is one of the kind of the best of the NHS and indicative of its problems, because quite often with kidney cancer, there are no symptoms. So the fact that it was caught showed that your GP was on it, the radiologist was on it. You've obviously had access to a surgeon that looked at it. But the fact that this could be getting on for 8, 9, 10 months before you can actually have it removed, which is the best clinical pathway for you, must be of great concern to you.
Yes, it is. It's worrying. I'm fairly stable, but I must admit I did lose my rag last week when I called the hospital, which I haven't done before. And afterwards, I kind of kicked myself for doing that because it's not right to to do that. But I am quite stable in these things. But as I say, I rang my GP, and I actually coerced the GP, and she was kind enough to write to the hospital as well. So I'm hoping all of this will bear fruit, but I don't want to gazump. My intention is not to gazump somebody that's got got a more serious, for example, a larger tumour than me, or a more aggressive.
And these are the really difficult decisions that people are having to make. Look, thanks so much for coming on, Phil, and telling us about your particular situation.
It does feel like the system isn't sustainable. Is that fair, or is that too strong a phrase, do you think?
Well, first off, I just enormously sympathise with Phil. Just before the pandemic, I myself suffered from cancer, and I absolutely understand the anxiety of just desperately wanting to get on with it. But I think, today's problems, the acute problems, are very much faced around workforce. The fact that we need many more people. That's the particular challenge. And we also need social care to be addressing. The backlog in hospitals of people who just can't be discharged is an extraordinary problem as well. But in the long term, the issue that I've written about sort of recently in a book called Side Effects is trying to look at what we're really, really trying to do with healthcare. I mean, for instance, in 1949, when the health service started, there were about 250 drugs. There are now 18,000 that can be prescribed. They get increasingly expensive. It begins to feel sometimes that the health service is just a bit like World War I, pouring more and more money into a battle without being absolutely clear what it's trying to achieve. In the war, we knew what we were trying to achieve, but as Ruth said earlier, the number of people who don't want to live to 100, we want to have a good old age. That's everybody's dream. Do we really focus on the best ways of doing that? And I'm pretty certain that we don't.
Is there a problem, David, that we worship at the altar of the NHS? So almost before we can even get to those detailed points you're making, we have to do the dance of saying how it's a sort of national religion and it's the greatest thing in the world, where in terms of outcomes, it isn't. We know that for people cancer outcomes. There are plenty of other countries where you get your cancer treated more successfully than this country. And that's not to denigrate the NHS, but do you think we have a problem that we can't see the NHS clearly in the first instance?
Oh, yeah, absolutely. But I think there's also a mistake to say we've got problems, therefore it's the design of the NHS that's the problem. Fundamentally, if you look at the proportion of GDP spent on health, it's lower in this country than many of those who are quoted to have much better outcomes. Well, surprise, surprise. But I also think we could spend our money in much more intelligent ways. We always focus, of course, and understandably on the dramatic, on today rather than tomorrow. Ministers always talk about the importance of prevention and of public health and so on, and then promptly take all the money away from those areas. In a classic area, we know that there's plenty of research that shows if you have a general practitioner that you know and see on a regular basis, and we have what's called continuity of care, the results are dramatically better. A study from Norway shows that if you see the same GP on a regular basis, hospital admissions are reduced dramatically, 25% lower chance of dying early. And yet in this country, we pour all our resources into hospitals, which is where the drama is. 2004 to 2021, number of hospital consultants up by 83%, number of GPs fell. But if you put your money into primary care and have a doctor that you know, trust, have a good relationship with, number of hospital admissions plummet. What a daft place to put the funding. If you really want to sort of address the issues, put the money where the results are.
But how do you turn the supertank around? Because that's evidence-based, that's thoughtful, it's intuitive, everyone would agree with it. But what it would actually mean in practice, David, is them chucking a lot of money into primary care, into GPs in the beginning, while still maintaining the old system. And that's the problem, isn't it? They'll have to invest so much in the short term to change the system utterly that no politician, particularly at the moment, is willing to do that.
Sure, and I absolutely get that. It's as you say, it's turning the ship around. I have absolutely no idea where we should get to. It's the getting there, and that's going to take political courage, and it also requires the public to get involved in a debate about what are we trying to achieve. Is it just pouring vast amounts of money into ever-increasing drugs, frequently with not terribly good outcomes, or pouring more money into some of these preventative things? I do understand that the newspaper headlines always come from today's story, absolutely understandably. But if you don't address the future, you're never going to be able to turn this one around.
And actually, we all have a responsibility, don't we? If we, so much of our health is in our own hands, and we can't moan about the NHS if we're eating too much, or we're not exercising enough, or we're not taking care of ourselves. That we're part of the equation as well.
No, totally, absolutely right. I remember many years ago when I was a GP being asked by a patient who was temporarily in my area. He was worried that he'd left his blood pressure pills behind. And I noticed that when I saw him, he was, I think if I remember rightly, he was 23 stone. He was a heavy smoker. But his anxiety was about not having his pills rather than about his health. It just, for me, exemplified the need to take all these things on board. And it's very complicated. I understand the reasons people smoke, people overeat are complex. But if we don't address these, and if people don't take their share of dealing with these, we're in long-term trouble.
Yeah,